he manipulating me and telling me what to do. And the next time I went, we started on a routine.
Right, exactly.
But he was able to go through a whole checklist and to determine my strengths and weaknesses.
Right. And even if you go like once or twice, it's at least a start, and they can just give you a home exercise program. If your condition requires exercise, you might not, and you go from there. So I would, physical therapy is such a good profession. I like it so much because you actually get to know your patients, and it's not like a doctor where you see him for 5 minutes and you're like, bye, and that's it.
That's very true.
So,
I often wonder about that because I have so many concerns regarding this. I mean, he is saying, that, everything looks great, but what he's saying is everything's in the right place. But I'm not understanding why I have so much, sometimes difficulty in, well, just walking, if I walk very far, I get a big limp.
because he's a surgeon and he's just looking at his work.
Yeah, that's
He's
all, he's
just
very
looking
proud
at-
of his work
yeah.
too, well, I'm proud of it too, but I mean, but you're right, exactly.
Whereas
right.
therapists look at muscles, joints, nerves, your whole body.
Yeah, that's what I need, that's what I need.
And I have trouble with my hip, and so I was going to physical therapy.
Yeah.
Actually, I have 2 more visits, and so I asked her like the difference between, my hip always goes out.
Oh,
And I know, I can feel it.
yeah.
And so she showed me some exercises, and she said, don't do them all the time, but when I have that feeling to do the exercise. So the idea is to build the muscle to hold
Yeah,
the
that's what I
bone in
need.
place.
That's what I need to do.
Absolutely.
That's why for knees, right, to build
That's-
your quads up, and your knees will have more
In your
support.
core.
Because I asked the difference between a chiropractor who like manipulates you, and she said, but they're not telling you how to build that muscle, how to exercise that muscle.
Right. We look more for long-term results, whereas a chiropractor, like, you'll come in, they'll do an adjustment, and then that's it. Whereas we give you the tools to kind of solve your own problem.
Right.
And then if you decide you want to get rid of the pain, you kind of do it yourself, because you're not going to come see us forever.
Mhm.
And there's no point. It's that whole analogy. What's that thing that's like, teach someone to fish, you feed them for life?
Right,
Teach
right,
them to fish.
right.
That's kind of what it is. It's like we want to empower people to, we give them knowledge and they do it themselves for like lifelong health. And not just for, come in, I crack your back and you leave.
Exactly.
Although nothing against chiropractors, because we do manipulations too.
Mhm.
But it's
Yep.
more so, we're giving you the tools to.
Which I didn't realize until she started working on my pelvis, and that's what
Oh, yeah,
made me
we
ask her,
do it too.
what's the difference between what you're doing and the chiropractor is kind of the same. But it's true, she is showing me exercises and telling me which muscles I have to work.
Right.
That's what
A lot
I
of
think the
problems are
fact
from
that
muscle
you're,
bounces.
that the doctor is getting to be the thing now, that's gonna move your practice a lot more into the medical side, doesn't it?
It
Yeah.
does.
And that's gonna be a plus, in my opinion.
You can come to a physical
Yeah.
therapist now without a referral from a doctor.
That's what I,
Yes.
see, I can see that.
Which, so if you have a good rapport with a therapist, you
Tell
can
her
trust
that
them.
again, because a lot of
Yeah.
them
I just found that
Because
out.
I think a therapist really would do me, because the last time that I had a knee, I said to my doctor, well, since I've had so many things, is it okay if I just go to the Ocean Club and use the bicycle and the treadmill and do this stuff, that I know from the
Mhm.
visiting nurse coming? He said, oh, see, trust me, he knows I'm gonna do it.
Mhm.
It's a big difference. So he said, yeah, you can do that, and it's true. I did it, but I did it religiously. And it's almost as good as this one, but the reason it isn't is because in the meantime I had the other surgery on the abdomen and it stopped a lot of it. But I think you can, but you have to really get people motivated enough to really keep doing it.
Right, so if you have a therapist, or it doesn't even matter, but if you have a therapist that you like and build a rapport with, you can now see a physical therapist in New Jersey without a doctor's
That's
prescription.
great, I think that's great, yeah.
And I do.
The caveat to that is, will your insurance pay for it? And not all insurances cover it.
Yeah.
So you would have to check that out. But if you just wanted to come see me at BSR when I'm licensed, you could. So you would not need, and because I have my doctorate, it's like, it's encompassing everything. It's
Are you gonna be in private practice? Is that what you're gonna do, just work for yourself?
in private practice, probably not initially.
Too hard to run an
Money to
office
start the
and
practice.
run
Do you know what, are you
Ernie-
specializing in any part of the body, or is?
You
Do you,
can-
in physical therapy, do you
Yeah,
specialize?
you specialize, but, so everyone at BSR has their orthopedic certified specialist.
Okay.
You can also be a neurologic certified specialist, you can be a diabetes certified specialist, geriatrics, pediatrics. And
Oh, so
then
it's not elbow, shoulder,
you can, there's no like actual, certificates that are like, you specialize in the
Right,
elbow, but if
right.
someone happens to work with the elbow a lot, they can say, hey, I work with elbows a lot,
oh, okay.
person to go to.
Yeah.
Not to take anything away from doctors, because we have to work in unison with them, but being able to just see a physical therapist outright is kind of good, especially if you know that you're gonna benefit from therapy, which a lot of conditions do, a lot.
Yes, like what the owner said to me, which surprised me, he said, we need to let people know that you yourself can go to therapy all on your own and have them help you so you don't have to have knee replacement, you don't need surgery.
Right,
So that's just a good way to
So
look
how
at
would
it.
it work? Could you just make a visit, or do you have to set up a series of visits?
either way, you can do one visit, see if you
It's a
want
nice
to
1
continue it,
hour
and the therapist will tell you
initial.
if you're appropriate for therapy or not, because if you're not, we're not gonna keep you
And
on.
check out your insurance,
Yeah, and
Also.
they'll look at the insurance.
a big thing.
That's a huge thing.
But they'd be able to tell.
Yes, it's mostly front desk people, and you have insurance, staff that can tell you that. The girl we have at BSR is really good. Personally, I don't know anything that much about
No.
insurance, because
Yeah.
I know the therapy aspect, but they have people who, and if insurance is not gonna cover it, just, you don't have to come back. There's no pressure, because I realize how expensive it is.
BSR, I might have not come by the time you mentioned what it was. What is BSR and where is it?
Barnegat Sports Rehab and PT is, right up, what's the name of the
Bayonne.
meeting room? It's Bayonne.
Yeah,
That's
right where Barnegat
Yeah,
Boulevard
here's
goes
the,
down.
Where Barnegat, what is it?
Where Barnegat Boulevard goes down, there's a Rite Aid, there's Walgreens, there's BSR, and then
Oh,
there's
it's
the
up there
old
near the
Walmart.
Parkway.
Yeah.
Yes.
Okay.
Come up there.
Yeah, it's up Bay Avenue.
Well,
near the
Kristen
Parkway.
said where Genardi's was.
Yeah, okay.
That's why
Everybody knows that.
It's after the
Not
police station.
everyone.
Oh, not you?
But it's after the
Okay.
police station, it's right on
Where
the
they
corner.
put that
Where
new
they
lane.
live.
Oh, right.
It's a really good, and this isn't even just like a marketing tool, it's a
Oh,
really
now
good
it's one.
place. I don't even work there, and it's, I wanna
Yes.
market it because it's such a
And
good
I just
place.
want everyone
That's
to
what
know,
I like.
It's awesome.
Is that where you work?
I don't know.
this is where I work.
Because I went to some.
Ernie, Ernie's
There's
the
bad
owner,
therapy out there.
and he is the most gentle, kind man I've ever met in New Jersey. I think.
Ernest Gamble?
He's the kindest, most gentle man I've ever met in
Yeah.
New Jersey.
Wow.
He's really nice.
So,
That's where you got together?
Yes,
yeah, she needed some
Mhm.
extra just hours, volunteer
Mhm.
hours, and I thought of all my wonderful
Yeah,
mothers.
This was great, because then you get to see what you're gonna actually.
I haven't told you, I've adopted all of these girls like my mother, because my mother is 2,000 miles away.
Yeah.
So, right?
Mother's lovely.
But you're all like my adopted mothers.
And sister.
One of those things.
And my sister, this is not my mother, my crazy
Do you
sister.
ever go to the run on Route 72, or just the Barnegat offices where you work?
Both.
Oh, you do both? Okay.
And
I never, where in Route 72?
we are where the gynecologist, Dr. McDermott, headed.
By the hospital? We're by Health Village, right?
No, we're the
No?
other direction, almost all the way to the ocean. We're headed east on Route 72, and on your left, there's a big office on your left, Ocean Women's Health.
Is it right near like the Chinese place?
Yes, right next to the
Buffet
Chinese.
Wait a
Oh,
minute,
that's
that's
Chinese
by
buffet.
Park.
That buffet one,
Oh,
after
okay.
Burger King.
Take me there again. Right.
And what do you do for
72.
them?
East, go way east,
Okay.
and
how
the
far
Chinese
east?
place on the left, how far?
It's that new building.
It's like 1 mile from the
It's a
ocean.
brand new building
Yes.
there,
They
okay.
just built
I
it.
know where you're talking about. I didn't know
I've never
anything was
seen
in
that
there yet.
building. I wondered what it was.
Huh. Okay.